So I'd now like to move on and pass the microphone to Katie Frost. And Katie's presentation is entitled A Guide to Motivational Interviewing for Healthcare Professionals, a Tool to Support Patient Care. Katie.
Thank you. Well, as a coach like you, I'm interested in really helping people to make healthy choices and decisions in their lives. But I don't think that's easy. And I'd like to share with you some observations that I have about some of the challenges that we face. How can we help patients that find it difficult to make healthy decisions about their lives? Especially when those emotional barriers can appear to get in the way and block the logical and rational course of action that could be taken. What influence can we really have with patients and families? If they've decided that they don't want to change, can we really influence that? And why do some patients move forward and others get stuck? Is it something that we're doing or something that we're not doing? And these questions and observations led me to explore motivational interviewing, and I'm really excited about the results. And I'd like to share some of the skills and some of the techniques with you to help you in your consultations with patients and with families to really work with adherence to growth hormone therapy. And we're going to be together looking at this question: what can we do better to motivate patients and families to overcome the practical and emotional barriers that hold them back? Now, I'd like to invite you to participate in a poll. So please get ready to do your vote now. Is it better to hear good reasons to adhere to growth hormone injections from you or your patient? So please vote now. Is it better to hear good reasons to adhere to growth hormone injections from you as the healthcare professional or from the patients? Now we're going to be coming back to our answers to that in a few moments. So let's look now at what is motivational interviewing. Well, motivational interviewing is a collaborative conversation style for strengthening a person's own motivation and commitment to change. And it's based on the work of William Miller and Stephen Rolnick. It's a person-centered approach. And with this person-centered approach, this is about helping patients and families to create their own argument for change. So it's a structured conversation that you can use to engage patients and families, helping them to pinpoint what they really want to achieve and what will work best for them. It's about drawing out that inner motivation that they have for change towards adherence of their growth hormone therapy. Now, the good news is you can lean into motivational interviewing in your consultations, and it's particularly good for helping to deal with mixed feelings. So, for example, we could take a patient that on the one hand wants to adhere to their growth hormone injections, but as Rachel and Jenny have pointed out, sometimes life just simply seems to get in the way. Or it could be a parent who, on the one hand, of course, they want to support their child with their injections. However, on the other hand, they're put off by some of the battles that they need to face when they're doing that. So let's draw on your experience of making healthy life choices, because this is a way of really understanding something about how motivational interviewing works. So some of you will have made your healthy life choices around perhaps giving up smoking, perhaps reducing your alcohol intake. Some of you might have decided to do more healthy eating. And so I want you to think of those situations and think about some of the people around you that have been helpful and unhelpful. And we're going to start first with answering this question. When you've been making those healthy life choices, how have people behaved around you that you've found unhelpful? And I suspect that some of those unhelpful behaviours have been things like not really listening to you, perhaps asking you questions that you feel are forcing you down a path that you don't particularly want to go, but that you feel the person speaking with you wants to go. It could be that sometimes people apparently have made assumptions about you, and it could be that sometimes you feel that you're being a little bit judged. And when we see those behaviours, interestingly, how do we react? And I think what we do is we actually drop down barriers and we actually resist. So let's look at those people who perhaps have been more helpful to you when you've been making those healthy life choices. What was helpful about how they interacted with you? And I think it's possible that you found that they were really genuinely listening to you and really empathising with what you were saying and seeing things from your point of view and asking you questions to help you explore your thinking and your feelings. And I'm sure that at no point did you feel judged. And those are really the kind of behaviours that we're trying to really get hold of when we're working with motivational interviewing. And we call that the spirit of motivational interviewing, or if you like, the principles of motivational interviewing. So let's have a look at those in a little bit more detail. So you can see that in this diagram at the top we've got the word collaboration, and this is very important in motivational interviewing, that we are really working to partner people. And in your consultations, let's remember that in fact everybody is bringing expertise into the room. So for example, your patients are bringing their expertise on themselves, parents are bringing expertise on their child, and you, of course, are also bringing your expertise into that interaction as well. So in a sense, we're collaborating together as equals. Let's look at acceptance. Acceptance is important because this is profound acceptance of the choices and the decisions that people are making for themselves. And in motivationally interviewing, we accept those choices. In a sense, we guide and they decide. Now, another behaviour that we're looking for is, of course, compassion, which I know you're so good at, that genuine care and genuine concern for the patients and families. Perhaps a new word to you is evocation, and this is a word used in motivational interviewing, and what it means is really drawing out that person's intrinsic inner motivation and commitment and building their belief. And it's amazing because in just using these principles you can get results. So even before we look at the techniques, I've got results just using these because they are really opening up conversations for people and making them feel relaxed and trusting you and building that relationship. So let's look now at some of the core skills in motivational interviewing, and these are important for some of the things that, for example, John mentioned earlier, because we're going to look at open questions, affirmations, reflective listening and summarising, and together they form the acronym OARS, and that's a good way of remembering our skills, because what we're doing is we're structuring our conversations using these OARS and guiding people and perhaps sometimes nudging them with those healthy decisions. So open questions open up conversations. They're questions like what and how and why, and they get people talking. And that helps you to understand people better and to really understand more about what motivates them, what's going on from their perspective, what their needs are and what they want. So I've got some examples for you here. So for example, you might ask, what are your hopes for your consultation today? And in asking that question, what we're doing is inviting the person to talk about what's on their mind, what their needs are, what their priorities are. And straight away, you're gathering important data and information that you can work with. Or we could ask, I'm curious to learn how you've been getting on with your injections. And that is likely to get people talking about perhaps even mixed feelings that they've got with those injections. And can you hear how that is a better question than, are you getting on okay with your injections? Which is more likely to just get a yes or a no answer. You can ask, help me understand more about why you would even consider changing this. Now, can you hear with that question, we're tapping in more to what's really behind somebody's thinking and their beliefs, a little bit more about their motivation. And we're very careful to put something in front of that why question, just to soften it a bit by saying, help me understand, so that the why doesn't come in too critical. So those are your open questions. Now let's look at affirmations, and we can't get enough of these. Affirmations are about really helping people to recognise their own strengths and the positive beliefs that are going to help them to adhere to their growth hormone therapy. So examples here could be, say for a patient, I can see it took courage for you to try this out today. Now, when you say that, that's making that person feel good about themselves and tapping into their own strengths and beliefs. And that's what's going to be ringing in their ears when they leave your consultation. Or you might say to a parent, your creative ideas around this are very helpful. And that's a way of also helping you reinforce some things that parents are doing that are really helping their children. Reflective listening. Now, this is going beyond not just listening to what somebody's saying or how they're saying it, but what they might be inferring, what lies behind what they're saying, and then playing it back to them and offering it back. So it's tapping into their thinking and their feeling that they might not have said. So for example, you might say, this sounds important for you to overcome. And it's interesting because they might not have said that, but that's what you sense. And when you get that right and you reflect that back, it's like a present for them, and it really shows that you're in tune with them, that you're empathising. And it can lead to further conversations. Sometimes people really don't know what to think or what to feel, and they'll tell you that. And it can be useful to facilitate them by asking, I'm wondering if you're finding it difficult to know where to begin with this, to get them started. The last skill here is summaries, and these are great ways of wrapping up conversations and also really pulling together any issues or mixed feelings that the patient or the family may have. And here what we can say is, let me see if I've got this right. You're feeling this on the one hand and perhaps feeling this on the other. And sometimes just presenting that can really give people real insights into actually their own behaviour. Or we can say, so what you're saying is. Now let's go back to our poll, and I can see the results that are coming in here. And you were asked, remember, is it better to hear good reasons to adhere to growth hormone injections from you or your patients? And I just need a little bit of help because I can't quite see.
I have the result. I have the result of the poll. And the result is 65% said the patient, and 34% said the healthcare professional.
Lovely, thank you. Okay, so for those of you that said the healthcare professional, I can understand that because of course you need to be supporting people with these good reasons to adhere to their growth hormone therapy. However, maybe you could consider that it's the patient that we really need to get these good reasons for, because if they're articulating these good good reasons, then they're articulating their own motivation to make sure that they're adhering to their growth hormone injections. And that's important because when they go home, you're not going to be with them. You won't be with them to motivate them then. So you need to hear it ringing in their ears before they leave your consultations. So I'd like to share now a couple of techniques with you. And the first technique that I'd like to share is elicit, provide, elicit. And this is where you can use your open questions and your listening and your oars, your skills to be able to make this technique work. So first of all, we elicit, and we elicit using our open questions to find out what people's capabilities are, what their understanding is, what their motivation might be. And really gathering that information is important because that helps you to position the information that you provide and tailor that information to the needs of that particular person. So we often ask for permission to provide information and perhaps signpost. Now, once you've provided that information, it's equally as important to check how it landed with them. So it's good to use your open questions again and ask, what do you think about that? How do you feel about that? How does that sound? Because if there are any barriers at this stage, you really need to know about them to be able to support the patients and the families in moving forward. Now, the final technique that I'd like to share with you is decisional balance. And this is really good for dealing with these mixed feelings. And it's interesting where we start with decisional balance, because we start here looking at the advantages of not changing. So this is about looking at the advantages, disadvantages, the pros and cons. So starting with the advantages of no change, we might ask, what's on the plus side of you missing some of your injections? Because we're curious, because we're interested, because whatever the answer to that is telling you a little bit more about why they may not be adhering. And then we can move to the disadvantages of no change. And we might ask, what are the not so good things for you about missing your injections? And the answer to that will help us understand some of the mixed feelings that they have, some of the reasons that they might be thinking about adhering better. Then we move to the disadvantages of change, because we need to know this as well. And we might ask, what are the downsides to doing something about this? And some of those downsides could be perceptions they have, or they could be practicalities. And either way, we really need to work with those barriers and understand them better to be able to help people to move forward. And then we can finally ask, what are the advantages of change? And that's your final question, because you want that ringing in their ears. What are the positive points for you about remembering your injections? And it's amazing how people will talk about all the things, the reasons, the good reasons for change that you want to hear and that you know is important to them. So we use these techniques and our skills and our principles of motivational interviewing, and you can use them in your consultations. And in doing this, you can see that motivational interviewing can support the 3 distinct phases of adherence by encouraging that uptake, supporting the implementation because you're tailoring what you're doing to the person that's in front of you, the patient and the family, and of course developing persistence, developing that motivation and that confidence and that belief for change. And I'd like to encourage you to explore motivational interviewing more.
Thank you very much. Well, there are some key messages, and perhaps the most important message is that healthcare professionals need training.